Within mast cell, there are these two camps, right? And goodness, how much further would we be if we could get consensus 1 and consensus 2 people at the same table to have a civil conversation?
We're at this divide of we've got to get on the bus all together and really help each other learn and navigate how our healthcare system is changing. And in the immune world, we're at that forefront of like, how do we predict who's going to be managed without much intervention? And maybe a lot of these non-medical approaches versus patients who their trajectory is happening very fast and needs treatment to slow down and halt the rapid progression. And how do we identify these people? And I think we're there, it's happening. And I think we're building ways to figure this out.
Autoimmune is a large and growing market, sadly, growing fastest in young adult women. So yes, we need to do that.
But what happens if we don't have a test for it? The biggest test that I have is talking to somebody and seeing what has worked, what hasn't worked, what's affected your symptoms. When's the last time you felt good, right? What's made it, like that's like creating a narrative is my biggest, the best test that I could run. Guess what that reimburses? Nothing. And so we need to go back, the medical students, we just need to put so much more attention into understanding the patient narrative. Like when I was a resident and a fellow, and residents were writing notes, I was like, you get one problem. Don't write like subclinical hypothyroidism or whatever. Everything is due to one thing. Create the narrative, understand the story, right? How did they get here? It's all one thing. Find the common denominator and work your way back, reverse engineer what's going on. Because the testing is fine. Of course you're gonna run tests, but yeah, when you're dealing with this patient population, the testing just doesn't move the needle. So you just gotta listen to people. And unfortunately, the model of medicine doesn't prioritize listening.
One of the first lessons we learn as students is listen to the patient, treat the patient, not the test results. But one of the first things we forget when we get on that treadmill of seeing patient after patient is that you stop trusting or maybe you don't get a chance to even trust your clinical judgment anymore. Most folks don't realize or don't let it sink in that 30 to 40% of people have normal blood work. And so if the lab is normal, high five, it must be normal, or fibromyalgia or something else that's like used as the brush off. Just part of like my last 6 years is what is the reluctance and to what level of certainty do we need to have to say, it looks like a duck, it quacks like a duck, it has feathers, a beak, and the little feet, right? With mast cell, for instance. Nope, got to have a positive tryptase. Can't Sjögren's, we don't have a positive SSA.